Okay, thank you everyone for joining us on this Valentine's evening. We do appreciate it, whether you're staying at home for some self-love or you guys are going to be going out afterwards. We do appreciate you taking the time to join us for this female reproductive health webinar. And then we're going to have a lovely portion on how to keep the spark alive whilst trying to conceive. Mandy is a clinical psychologist in private practice. She is also chairperson of the counseling arm on the SASREG board. She has worked in the field for nearly 30 years, coinciding with her own IVF journey and miscarriages. A lot of her work involves counseling individuals and couples in their fertility journey. This also involves assessing donors, recipients, and surrogate mothers. She has written 2 books and developed an online stress management portal, initially for women's health, now extending into corporate health. Mandy, are you there?
Yes, I'm here. Hi, evening everyone. So I have prepared a couple of slides because it'll just be easier for you guys to take pictures and more of an explanation just in case I don't get through them all. Saskia, can you enable screen sharing?
Sure. Okay.
So thank you for all attending. I wanted to, let me just screen share. Okay, there we go. So the problem that I'm finding lately in infertility is that we're seeing a lot of the couples after the fact. I'm surprised in the last year how many people have come after having their babies and they're coming for premarital counseling, or let me say divorce counseling or mediation. And it's because they weren't married during their or managed during their fertility process. I posted all of these tips on a network on LinkedIn this morning, and I got a horrible reply from someone on my stream that said, how can I talk about him and her and gender in this day and age? And they found it very offensive, and they said that my talk is outdated. I deleted that response because I didn't think it warranted some kind of reaction from me, because I am specifically talking about what I've seen over the last 30 years between men and women. And I know gender and men and women have changed in terms of the understanding nowadays, but it has a huge impact on the marriage. And if I could put you all in a room together where husbands and wives talk openly about what's going on, you'll see that everyone has all of this in common. So when we look at a book called Why Men Don't Listen and Women Can't Read Maps, it's quite a humorous book written about the difference between men and women's brain, just in a very kind of rudimentary way, saying that men have the ability to box certain folders and certain files. So they're able to box work, and they're able to box sport and career and friends. But for women, unfortunately, a baby or not having a baby or fertility treatment impacts on all of these areas, which is why the women we see tend to become a bit more all consumed by fertility. Also, when men and women communicate, men will often hear the topic of what someone's saying and will ignore the paragraph. So we find that women will often say, I want to talk about it more and I want to discuss it every night. And the men are saying, but we've spoken about this. I don't want to hear the same thing over and over again. Men are more concerned about the impact of the fertility on their wives, and are often quick to say to me, my wife has changed and our lifestyle's changed. And they tend to say to the woman, we must draw a line because I married you to be with you. Whereas the women are a bit more all consumed and feel emptier, if I may say, as they go along the journey, and are willing to push those limits a bit further. Men are also more likely to keep quite private and internalize their stress, whereas women tend to share with family and friends. So obviously with discretion, and not all women, but you'll see when I get to how do we manage this as a couple, it's better to to kind of negotiate what your expectations are. If we look at couples going through ART or IUIs or IVF, what tends to happen is men tend to react fairly optimistically. They tend to try and appease their wives and say, it's going to happen. Let's look to the future. This is going to happen naturally, or it's going to happen with an IVF. Whereas women want to look at the worst case scenario. They almost want to look at, if this doesn't work, what do we do? In terms of finances, the men seem to worry more about this. Women have other values associated with having a child, values like a sense of belonging or a sense of not achieving. And the women we see are more likely to change their lifestyles. And I often see that there's quite a bit of conflict about goals and going out and expectations, because the woman can feel she's doing all the changes, and that's where some of the conflict happens in terms of social drinking, eating, smoking. And the last thing I want to say before I get to how do we support each other is women get to the T-junction and they've already had a look at where their destination is. So they've already had a look at, will I make use of how many IVFs and how far am I willing to go? Whereas men are more likely to only discuss the next step when they hit that stop street. So a lot of wives say to me, my husband is not keen to go further, but I often say it's when the fertility specialist or the decision-making team as a whole says, now we've got to consider the next step. That it doesn't mean your husband is not involved or engaged in doing the next step. It's just that they're more reactive. So the result that we have on marriage is independent coping, where both of you feel isolated, and this elephant in the room is often never discussed. So what do? So first thing is, it's not all about the sex. The first thing that couples say to me is the intimacy is a problem, and especially the men. I remember when there is physical intimacy, we do release something called oxytocin, and the only other time that is released is with breastfeeding, and funnily enough, with childbirth and hugging someone. So when I say we got to keep the spark alive, I'm not talking about leaving this talk now and jumping into bed and the intimacy's got to be back to where it was. Remember, the less intimacy you have, the harder it is to build that hormone up again. It almost takes practice. It almost takes forcing yourself or encouraging yourselves as a partnership to engage in a bit of intimacy. But rather, while you're going through this process, rather look at other ways of intimacy that can then start increasing this level. So the important thing with this is to stay connected, but not all consumed. So I often say to couples, let's do one date night a week, and you can take a picture of the screenshot or see it on the recording, but we need to have boundaries in communication. So what often happens is the husband starts being worried about coming home and talking to the wife in case he heard someone was pregnant, or in case the wife is down. He doesn't know if she's upset this evening or if she's okay. So he tends to ignore the topic of fertility, knowing that there's a certain path, because he thinks if his wife talks about it, they're going to get upset and she's not going to cope, and it's just going to open this whole Pandora's box. So I say to couples, have a date night a week where you do not discuss fertility or children or anything as regards conflict in terms of parenting or plans ahead. And then what you can do is, a lot of my couples between 7 and 7:15 at night, there's an allotted time where they can discuss their fertility. So if anything happened, you kind of save it up, and at 7 o'clock, you get a chance to discuss it with your husband, discuss it with your wife, and then you close it. Because many men say to me they're worried to take a call, they're worried to say anything during the day and they don't know when the conversation is going to be raised. So rather put a time aside where it can be raised and each party listens to the other. So I've got some patients who identify their love languages. There's a very easy test I'll share with Saskia later, which you can do on your phone, and it gives you your typical love languages. And I've got a husband who the only way he finds he can support his wife is by giving her, because her love language is gifts. So by bringing her a small gift every day while she's going through post-transfer to her pregnancy test. And these are just little things that you can do. You know, if you're not, as a male, someone who's going to speak and share your emotions, just attending this webinar tonight, watching maybe in that 7 o'clock slot at night, watching a YouTube video together. And men often have the strength in managing logistics. I know when I've gone into hospital at times, my husband's brilliant at logistics. I will tell him to sort out the medical aid. I will get him to organize all the admin because he's good at that. And husbands, if you can attend some of those doctor's visits, because women tend to start coping independently. I know it's a long wait, but it does go a long way in terms of the marriage. Now, there is a game I play with couples, which is identifying your fertility triggers. So fertility triggers anything like a baby shower, seeing a pregnancy notification on your social media. And men are often not aware of these triggers that you react to, just like you might not be aware of how your husband reacts to certain triggers. So it's helpful to sometimes put these down. And I have a set of cards where I do a game and couples, it's kind of like Snap. We put down 2 cards and they get to see if they agree with the triggers. And if they don't, they then explore that trigger. So if the wife feels jealous, for example, that a sister-in-law is pregnant, then that's validated and she's allowed to talk about it in that slot. So he can see why she is being avoidant. Plan for significant dates. This is for things like transfers, for things like aspirations, for things like a first visit to a fertility clinic. If you can, decrease your work hours or work remotely during that time if it's going to be pretty stressful. And also lower your expectations in terms of social engagements. We find it very hard as a couple to go to brides and birthday parties and kiddies parties at this stage, and it's okay if you avoid that. Also, another important thing is, are there mutual distractions you can both do together, such as watching a limited series on Netflix, something you can do together that does not involve fertility. And most important is have a discussion as to the next step. So it doesn't mean you both have to agree that our next step after all of this is IVF, or our next step is looking at donor options. Rather just have a look at what that next step is, introduce it to one another, and then don't talk about it. Allow one another to think about it. And it's so important to have a fertility counselor or someone you can speak to in terms of what the two of you are going through. Remember, your wife will reason emotionally through this process. I've done IVF myself, and a patient explained it to me the other day as she gets her negative result, whether it be due to IVF or after a failed aspiration or an abandoned cycle, we're suddenly removing all medications. So there's almost this spiraling down from this huge sense of heightened hormones to nothing at all. So if we both, or if your wife feels irrational, just understand that hormones also contribute to this. And that is why the negative results on this and these ups and downs and this hurry up and wait that we tend to get in infertility does tend to create havoc with our reactions to things. So we just got to tone down the way we react. And the last thing is, just because a couple is sharing hope and despair. So the men are more optimistic. The women tend to be more pessimistic about the cycle. Remember, the two of those together, if we had to look at algebra, they equal reality or realistic thinking. It would be dreadful if your husband also said, this is never going to work, what are we going to do? You'd actually prefer the benefit of this positive manifestation because you're not feeling as optimistic about that. And in a good, healthy marriage, we'll see that as the one is struggling, the other one is pulling the other one up, and then it tends to swap as we go further in treatment. So I'd just like to see if there are any questions, because there was quite a lot of tips that I put down there, but hopefully, Saskia, I can send those to you and you can put them on your website.
Thank you, Mandy. That's perfect. Yes, please. Oh, nice. That was a wonderful talk. Thank you. There's no questions that I can see in the box for now. If anybody wants to put one in, they're welcome to. But thank you. And thank you both for giving us your time this evening and your expertise. We really do appreciate it as always. And we hope you guys get to enjoy a bit of your Valentine's evening now, and everybody that's watching too, and takes on board what you've said, Mandy, to go forward with some more hope and communication and moving together forward. And also, Dr. Rod, thank you for your information. Also helps people to make a plan on, and I know a few people before they came on the webinar were really worried about their next steps. So I think hopefully they've got something out of this tonight and they'll be able to move forward on their journey. But just everybody listening, just know that we're here for you. You can contact us on our page. You can contact MedFem. They've got social media on Instagram and Facebook as well. And Mandy also has her pages that you're welcome to connect with her on LinkedIn, on Instagram, on Facebook. So please do reach out. Will the recording be posted? Yes, the recording is going to be on our YouTube channel. Yeah. Somebody's asked, thank you for a wonderful session. There was a question earlier, Mandy, about a teenager being diagnosed with PCOS and has now developed anxiety and depression due to a lack of quality lifestyle. How did she talk to her teenager about that?
Look, I think with PCOS, there are a range of symptoms, and I assume she's coming up with maybe the typical symptoms of acne and maybe difficulty losing weight. And of course, those have a huge impact on your mood, your self-image. PCOS can cause depression. It can cause hair growth on your face. She is probably at this stage, I don't think, the mom hasn't said if she's concerned about her fertility at this point. With PCOS and IVF, there's actually very high success rates, if that is something she's worried about. But possibly your mom needs to have a look at what are those physical characteristics she's struggling with. Because there are ways, I mean, some of my patients who are younger are on skin cream, or on Reaccutane, or they are managing their diet or exercising. They're doing other things that are helping to manage those physical symptoms.
Thank you. Thanks, Mandy. Thanks, Dr. Rod. We'll post this on our YouTube channel and MedFem's YouTube channel next week once we've managed to edit a bit. And we'll put it out on all the channels when it comes, when the video goes live on the channel. So please follow our Facebook page, follow MedFem's Facebook page, follow Mandy. And just Mandy gives out some really interesting information every week of how to deal with your mental health, and as does MedFem. So it's worth following all of those channels. So have a lovely
Saskia. We really appreciate everything you do for the patients and for us. It's fantastic.
Yeah, I echo that.
Yeah.
Thank you.
Thank you. It's a huge pleasure. Bye, guys.